Hi everyone, it's Emma Cowley here, one of the lecturers in podiatry at Plymouth University. I'm just going to spend a few minutes talking to you about how you can get the best out of your own potential when you're set a piece of coursework on the podiatry degree. So the first thing to note is that when you're set a piece of coursework, it's with the idea of you meeting the learning outcomes for the module that you're working on. So the first thing really that you need to do is to obviously go to the first session of the module where the module leader will talk you through the assignment. What they'll probably do is not only talk to you about what it is, but also how to go about writing it. The important thing there then is to read the module handbook, because first of all the assignment guidelines will be in there, but also the assessed learning objectives as well, or the assessed learning outcomes for the module will be in the module handbook. So absolutely read the module handbook, download it, pin it to your fridge, whatever it is that you need. Make sure that that is your go-to resource. The next thing, like I said, is go to that first session in the module, because the module leaders will be talking you through how to get the best out of preparing to write your assignment, whatever it is. The next thing to note is that if you aren't great at writing essays, if you haven't had a lot of experience in it, or you're just not very good at it, you don't think it's one of your strengths, it's just a skill like everything else, just like scalpel work and everything else that you've been learning. So pop on down to the Writing Cafe. The Writing Cafe is held mostly down at the Babbage building on main campus, but they do visit the Pat building as well. And they are really great at taking a look at the work that you've already done, having a read through, and they'll see if your arguments sound coherent, and they'll look at your sentence construction and your referencing technique and all those kind of things that are all part of writing that essay and gathering the marks that you need. The other thing to note is that in the marking criteria, we're providing rubrics now so that you get an idea of what is a very good or an excellent essay, and what's one that's sort of middle of the road, and one that would be more of a borderline pass or maybe even a fail, to help you to construct your essay to maximise the amount of marks that you can achieve. So the point here to remember is that the marking criteria doesn't always go in the order that you should be maybe writing it up in your essay. So for example, you may find that diagnostics does come first and differential diagnosis does come first, but maybe measured clinical outcomes, that kind of thing, maybe down at the bottom of the marking criteria. But actually, if you use the SOAPIA approach in a case study or something like that, the analysis, so SOA, that's where you put your defined clinical outcome measures. So even though it's at the end of the marking criteria, it fits better in the middle of your essay. So just bear that in mind. The thing when you're writing an essay, just bear in mind as well that it's me or one of my colleagues that will be reading it. And we have just kind of the curiosity to know, we want to know that you know what you're talking about, that you're really comfortable with the topic that you're talking about. And if you read other people's work who've gone before you, people who've published, people who have even written in the media or gone on television or anything really, you'll notice how they always start by setting the scene. So you might want to begin by making a point that the condition you're about to talk about, or maybe it's falls or something like that, talk about its impact. How important is this? Is it costly to the individual, costly to the NHS? Does it progress if it's not managed effectively? Why are we even writing this essay? What's the so what factor? You'll hear me talk about that quite a lot. So what? Tell us your so what factor and make sure it's built into the introduction of your essay. And that way you'll nicely lead into the essay, and the reader will want to go on and see what you did to answer that problem, basically address that problem. The next thing to bear in mind is take a systematic approach as well. It can often feel most natural when you're doing a case study, for example, to almost follow like a patient journey timeline. So you might want to use the SOAPIA model, as I've just suggested, which is the subjective, objective, analysis, planning, implementation, evaluation and review. And that takes you through a lovely cycle all the way back up, so that if you didn't have the correct diagnosis, that the cycle leads you back to the reassessment again. So when you're writing an essay, think about the reader, think about what they'll be thinking that they want to see. If it's about a case study, they'll want to see how the patient presented, what you did to sort out what diagnosis they had, how you maybe formed some hypotheses as part of that by taking a history, then went on to objectively test your hypotheses and rule some of them out until you were left with the likely diagnosis or the clinical impression. You can then evaluate things, analyse things, you should use the right word, analyse things such as maybe talking about flags, identifying that you have considered barriers to intervention, maybe motivating factors, pragmatics as well, things that you've got in your clinic. So maybe that shockwave is the gold standard for something, but if you don't have a shockwave machine in your clinic, you may need to be proposing alternative therapies. The other thing to bear in mind is at level 4, 5 and 6, that's the first, second and third years of your degree, that you'll be assessed at different levels. So you might want to Google Bloom's taxonomy. It's quite helpful to work out what we mean by this. So essentially at level 4, we're building the foundations of knowledge, but we're not going to test you on developing arguments at that stage. We want to know that you understand the knowledge, you know what things are, you know how to use knowledge appropriately, maybe how to describe things. Tests such as screening tests like the ABPI, that kind of thing can come into this. But you're not critiquing necessarily at this level. Then you go into the second year at level 5 and we want you to start forming arguments. So to do this, you need to be embedded in the peer-reviewed literature. This means reading journal articles. Excuse me. So just to be clear, a journal is not a diary in this instance. A journal is an academic piece of literature. It's a bound piece of literature. It can be found in hard copies in the libraries. But fortunately for us, you can also find them on the e-library through Primo. So the way to do this would be to do a structured literature search, find some keywords, go to PubMed, you might want to even go to Google Scholar, all the databases like Embase, things like that, you can find them all through our library. And then go to Primo, which is a catalogue, to see what Plymouth University actually holds as a full text item. And if it doesn't hold it as a full text, sometimes the abstract is enough to sort of play one study against another to form an argument of why you might want to use that evidence to make a clinical decision. Sometimes you might have to make a request to the library and see if you can get the full text article elsewhere. So yeah, at level 5, we want you to start pinning arguments together. So what this means is when you're about to make a clinical decision, maybe it's selection of a test, maybe it's the selection of a therapy, maybe it's even talking about the prevalence of a condition. Whatever it is, go to the literature, the peer-reviewed literature, and find out what studies have been done already. Go for the newest studies, ideally. The reason being that as technology improves and scientific method improves and the profession matures as a scientific profession, our methods have got better. So we'll find that older studies may not have detected something that newer studies will have detected. The other thing to bear in mind as well is that not all evidence is equal. So go and Google the hierarchy of evidence. And that will show you how, for example, meta-analyses and systematic reviews are the gold standard of evidence. So a systematic review can be quoted almost in its own right because it will already have critiqued the articles that have been used to inform the systematic review. A meta-analysis is one better. It goes one more than that and looks at statistical methods to find an effect size of a particular intervention, that kind of thing. Going down the hierarchy of evidence, we go through randomised control trials, cohort series, case series, down to just expert opinion. But what you won't find on there is Wikipedia. You won't find on there some of the unpeer-reviewed websites that you might come across as well. The reason being that they're not credible evidence. They haven't been put through a peer review process where people who have been through that process themselves and their work has been verified. What you'll find on these websites is no reference to a peer review process. So whoever wrote the web page, it's really coming from their opinion, which may have been informed by Now Magazine, for all we know. You've got to think like a scientist. Start thinking about critiquing evidence. So when you get to your third year, we're going to look for you to demonstrate understanding about what kind of evidence that you're using as well. So it might be in second year you maybe find two pieces of evidence that disagree, and you may want to favour one over the other because it's slightly more contextual, it's got a similar demographic to your patient that you're working with. that kind of thing. But in the third year, we want you to start talking a little bit more about why you think one study is better than another. And this might be that it has a bigger sample size, that the methodology was very well written and it answered the question. A great book to go and look at to work out how to critique evidence is a book called How to Read a Paper, and it's by a lady called Trish Greenhalgh, and she's unbelievably easy to read. These books are really easy to read, very helpful guides. There's also a website which I will post on the programme page. The name has just escaped me right now, but it's something that will really help you to look at evidence in the future. So, you know, apart from all that, you just got to turn up to the module, because a lot of the formative feedback that you'll get about your writing and preparedness for the submission of a piece of coursework will just come in the classroom. You'll also have your own opportunity to ask questions as you get into writing your essays over the duration of the module. Keep an open communication. Your module leaders are there to help you. If you think you're getting behind or you're just not confident, you don't know what you're doing, for goodness sake, let us know sooner rather than later. We'd love to help you, but we can't help you when you come to us too late. So we are an open door. We've all got our little booking policies. Come and speak to the module leader for the module that you're working on. The other thing I would really recommend is forming study groups as well. You may feel like it's a bit competitive, and I understand that, but ultimately if you're able to maybe delegate bits of the literature to go and search, you may be able to get the essay written a bit quicker. And if you've got a big workload on, or you're going to go on placement or something, and time is of the essence, that can really help. So yeah, I think I've covered most of it. Read the module handbook, turn up, engage, read well, find the techniques to write. So go to the library, go to the writing cafe, go to the Learning Gateway, anything that will help, and keep in touch with us, and hopefully you will get the mark that you're hoping for. All the best, guys. See you soon. Bye.